Good afternoon. My name is Courtney Anthony, and I will be doing my presentation on understanding the impact of substance use disorder on family systems. So an outline of what I will be presenting today is the identification of the topic, rationale for the topic, scope of issue and who is impacted, key issues, social work relevance, intervention strategies, lessons learned, and my reference list. So what is substance abuse? Substance abuse is the harmful or excessive use of illegal drugs, alcohol, prescription medication, or over-the-counter medications. This presentation will discuss substance use disorder and its impact on immediate and extended family systems. Next, I will discuss my rationale for choosing substance use disorder on family systems as my topic. So children growing up in households where parents and caregivers abuse substances can potentially lead to harmful consequences of high stress levels, instability, abuse, and neglect. Growing up in a household of substance abuse can affect the child mentally, physically, and academically. Adults that abuse substances can also have drastic changes on the family system as a whole. I think it is important to understand specific risks within the family and help aid them in prevention and intervention strategies. So the scope of the issue and who is affected. Substance use disorder has an impact on the entire family system, which can include spouses, parents, children. Substance use disorder allows for there to be a disruption in the stability of the family. There can also be loss of trust, development of dysfunctional roles, and a clear lack of boundaries. Extended family members, social networks, and community service such as child welfare services or therapist services are also indirectly impacted as well, because these family members are seeking treatment for their substance use disorder. There can also be a financial burden on the family. There are costs associated with treatment and rehabilitation, especially when individuals and families do not have insurance. Some family members may have gotten in legal trouble, so they may have a financial burden from fees associated with substance use related fines and arrests. The using family member may have lost a job and is seeking employment. The non-using members may also have to take off work to take care of the using member. So there appears to be maybe a loss in wages for the entire family due to substance use disorder. There are increased healthcare expenses because substance use disorder has an impact on the body, and it also has an impact on the mind. So there may be therapy and health disorders from substance use disorder. So substance use disorder creates an environment for a higher risk of domestic violence and child abuse and neglect. Domestic violence against children is a harmful social and familial crisis that frequently arises as an adverse consequence of substance abuse. Working at DHR, we often see clients that are affected by substance abuse. And although they may not mean to, there appears to be adverse consequences of abuse and neglect because they aren't caring for their children the way that they're supposed to. Children who are exposed to substance use disorders by their parents or caregivers are likely to develop substance use disorder later in their own lives. According to Ciceretti and Hanley, individuals who suffered childhood maltreatment tend to start drinking earlier, escalating during adolescence, and continue to elevate drinking into young adulthood. So there appears to be a correlation from children who are exposed to substance use disorder early in life or child maltreatment early in life tend to start drinking when they become young adults. Substance use disorder can have physical and developmental impacts on children's growth. It can affect the child's safety and increases the risk of abuse and neglect. Substance use disorder may have long-term mental effects on a child's self-esteem and emotions. Children may have trauma from witnessing substance abuse, and this can cause a child to have anxiety, fear, depression, and low self-esteem. It can also cause children to fail in school and become detached from their environment. Key issues. So one key influencing issue of substance abuse is trauma, anxiety, depression, and PTSD. According to a study performed by William Van der Brink, in a pool of alcohol-dependent patients seeking treatment, 24% were sexually abused as a child, 15% were physically abused as a child, 16% witnessed domestic violence as a child, 42% were physically abused as an adult, and 11% were sexually abused as an adult. So there appears to be a link between trauma, experiencing trauma, and developing or dabbling in substance abuse to escape from what you've been dealing with. Another key influencing issue of substance abuse is access and availability. It can be easy to access substances within a community that is prevalent in drug use. So there tends to be in low income and poverty stricken areas within the United States because it's easy to access. And in those areas, people are dealing with poverty, financial burdens, trauma. So they may seek to have some sort of coping mechanism, which is substance abuse. Importance to social work. So substance use disorder on family systems is important to the field of social work because social workers operate from a person and environment framework. This means that social workers recognize that substance use disorder is not just an individual problem, but a systemic problem of that person's environment as a whole. Social workers are trained to address microsystems, which is the individuals, and mesosystems, which is the family unit, and to provide supporting treatment. Next, I will discuss some intervention strategies to aid in prevention and intervention of substance use disorder. So the first intervention strategy is family therapy. The family therapy that I will be discussing is structural family therapy. The goal is to restructure the family system to eliminate the patterns that support addiction and establish healthier patterns. A family-based intervention can be helpful in addressing substance use disorder. According to Esteban et al., some research suggests that using a family systems approach for substance abuse treatment can not only decrease drug use, but also strengthen family relationships. So if I were a social worker applying this theory to a family affected by substance use disorder, first, I would join the family session and assess family dynamics, understanding their structure and roles. Next, I would map the structure. So I would create a visual guide or map for the family to see on paper how they are structured. Next, I would have the family role play how they normally handle situations and communicate with each other. Next, I would side with the family member who is identified as the user or the family member that is struggling with addiction in order to bring empowerment to them and balance out the dynamics. Doing that, you can kind of see that the other family members are against this family member who's identified as the user because they believe that they are the problem within the family unit. Next, I would restructure the family hierarchy and set clear boundaries and roles of each family members. I would set clear understandings of what healthy communication is and it is not. Often family systems have roles such as the hero, the scapegoat, and the enabler. So bringing awareness to these roles within this family unit can better assist in addressing the challenge of substance use disorder. So the second intervention strategy that I will discuss is psychoeducation and mutual support groups. So when speaking with the clients, I would explain addiction as a disease and not a choice. I would explain signs and influences of substance abuse. I would help the individuals and families establish coping skills and support systems within their environment. And I also would refer clients to support services outside in the community. Next is support groups. AA, NA, Celebrate Recovery, and 12-Step Recovery are examples of mutual support groups. A mutual support group are meetings where people facing similar challenges can share experiences, offer support, and foster community. There is not any research that mutual support groups are helpful as a first line of defense. However, it is believed that combined with strategic therapy interventions, mutual support groups are helpful. According to Donovan et al., 12-step recovery programs are easily accessible, no-cost resources for individuals with substance use disorder. Evidence supports that participation leads to better recovery and lower healthcare spending. 3 lessons learned. So from completing research on this topic and speaking with clients who have family members who have abused substances, I learned that people are resilient. Once people are able to heal from traumas and given the proper tools and support to overcome their addictions, they then do their best to not relapse. From this research, I also learned that people have to want to get better. The second thing that I learned is that there is a generational impact of substance abuse. Interventions are needed proactively early in children's lives who have been exposed to substance abuse to break that cycle. In doing so, children are more capable of not becoming substance use users in their adult lives. The third thing that I learned is that changing my view that substance use or addiction is not a choice but a disease helps me become a better social worker. It allows me to understand clients better and how I can help replace the client shame with empowerment. And here is my reference list. I hope you enjoyed my presentation. Thank you.